This is the Lone Crater YouTube. We hope this video helps.
Typical berberine dosing is 500 mg 2 to 3 times daily, taken with meals to reduce gastrointestinal upset. For weight loss, split doses every 8 hours to maintain steady blood levels and limit side effects. This means morning, mid-afternoon, and evening with meals. Start cautiously. Begin at 500 mg once daily for 7 days to assess tolerance, then increase to 500 mg twice daily for 2 weeks, before moving to 3 times daily if no adverse effects occur and your provider agrees. Berberine improves insulin sensitivity and activates AMP, which helps reduce blood sugar and supports fat loss. That cellular activation shifts metabolism toward burning stored fat and reduces hepatic glucose production, complementing diet and exercise. Combine 500 to 1, 500 mg daily with a sustainable calorie deficit of about 500 calories per day and resistance training 3 times weekly to preserve lean mass. Use berberine alongside a balanced diet of lean protein, fiber, and low glycemic carbohydrates, and prioritize sleep and stress control for maximal effect. Do not use berberine if pregnant, breastfeeding, or taking prescription diabetes medicines without physician approval. Berberine can lower blood sugar and may cause hypoglycemia when combined with insulin or sulfonylureas, so dose adjustments may be necessary. It can also interact with CYP3A4 substrates, increasing statin and warfarin levels. Consult your doctor before adding it. Common side effects include diarrhea, constipation, and mild cramping. Check fasting glucose and liver enzymes before starting and repeat tests every 8 to 12 weeks while taking berberine.
Thanks for watching. Consider subscribing if we helped you.